The big beautiful bill is now law, and it packs steep cuts to Medicaid. There are concerns that rural hospitals won't stay open, and even more concerns that rural hospital bills will be even more expensive.
You can't sit there and take something from someone that's a basic need because you just want to keep the wealthy happy.
People are speaking out after the Senate passed the big beautiful bill.
You have people that live off of insurance, state insurance, Medicaid, Medicare, through dentals, mental health services, and all that's going to be taken away from them, and it's just going to be a decrease in the population because of stuff like that.
President and CEO of Day Kimball Health, Kyle Kramer, says this bill will impact rural hospitals.
Rural health is uniquely recognized as its own entity, and healthcare in small and rural areas is indeed very different than that which exists in large urban areas.
The big beautiful bill will also make changes to Medicaid, including cuts to federal Medicaid funding and work requirements.
We're already concerned about Medicaid payments for those services, and in a small area like ours, we actually have a largely federal payer mix. So 70% of our payer mix is either Medicare or Medicaid. And for the Medicaid portion of that, we already have challenges financially covering the cost of providing that care. So cuts would certainly be a real challenge, which obviously has us, looking at every single aspect of what's included in the federal budget.
Some say this is going to hurt the elderly and vulnerable population.
It's bad enough that you have the elderly that can't speak for themselves, who have aides, who have to be their voices, and we're not heard now. So just imagine when you pull that and they need medication, they need transportation, they need that.
The Senate did propose a program that would allocate $50 billion over 5 years to support rural health care.
We are extremely gratified that there is the inclusion of a significant tranche of funds intended to support rural hospitals.
A concern I heard from several people off camera, they worry this bill will hurt the most vulnerable people. Kyle Kramer says he will continue pushing lawmakers to protect rural hospitals. In Putnam, Cape Patty Hood, Fox 61.